Try that again. Good afternoon, everyone. My name is Diego Ortiz, Communications Director for the American Heart Association. Welcome to a special conversation about women's health titled Take a Break, presented by Northwell Health. In just a few minutes, we'll welcome our special guest, Dr. Rachel Maria Brown-Talaska, Director, Inpatient Cardiac Services, Lenox Hill Hospital, Northwell Health, who will tell us what it means to break the mold. Then we're going to hear from heart disease survivor and mother, Giselle Lorraine Jaramillo Toscano, who will tell us about breaking down barriers in her health journey. And finally, we're going to meet Dr. Christina Delegates, Director, Women's Behavioral Health, Zucker Hillside Hospital, Northwell Health, who will help us break through to a future of improved mental and physical health. But first, I want to encourage everyone to take a moment and support the mission of the American Heart Association and Go Red for Women by texting Go Red NYC to 41444. Thank you so much. You know, the inspiration for this conversation began a few months ago when the American Heart Association and Northwell Health launched independent but parallel campaigns aimed at empowering women and men to take control of their health. Live Fierce by the AHA and Raise Health by Northwell are examples that we're living in a critical moment in the history of public health. And now I want to show you a teaser clip from these campaigns to help us set the stage for our webinar. Mark, can you play those videos?
The world keeps changing, so my mission is turning challenges into opportunities. I'm opting in, signing up, and using my voice. Today, I recommit to my shine. For myself, for my community, for our health. There is strength and possibility, and new opportunities are coming. With the American Heart Association by my side, I'm ready to thrive. Because we live fierce.
The default in medicine has always been man. Problem is, more than half the population are women. We have been understudied and misdiagnosed for too long. So Northwell created the only network of experts devoted to every aspect of women's health. When we raise the health of women, we raise everyone.
Thank you so much, Mark. And so you see, right now is a moment for us to really be having these conversations. So now I want to welcome, if you can turn on your camera, Dr. Rachel Maria Brown Talaska. Hi, Dr. Brown.
Good morning, afternoon.
Good afternoon. I know these days fly by, absolutely. So we just watched those videos, and as we're thinking about these conversations, and the title is to take a break. We want to talk about breaking the mold. We want to talk about breaking down barriers and breaking through to improve health. But this conversation, the one that you and I are about to have, it's about breaking the mold. What does it mean to break the mold?
So when I hear break the mold, it's not one mold. It's many molds. If we can think of it that way, it's the mold of how does a doctor look? How is medicine taught? Who is being taught medicine? How do we treat our patients? So there's many molds that need to be broken. And I believe we are on the path to breaking those molds. Some are a little more progressed than others in terms of how we've gotten and made progress over the years and centuries. But in terms of, let's say, who represents medicine, when I open the door and draw the curtain back and my patient's face shows surprise, it's, well, why are you surprised to see me? Are you surprised because I'm not a man, or because I'm not older, or because I'm not Caucasian, or because I'm so tall? I'm 5'10", by the way. But right, why are you surprised to see me? And often I'm asked, oh, so you're the cardiologist, but why is that not more commonplace? Like, why am I an aberration? Why am I not the norm right now? And so that's there's a traditional picture, right, of what the physician is in Western medicine. And that goes back to our history of an austere, paternalistic, elderly white male carrying a rather like domineering and omniscient aura. And that's our idea of what the doctor should be in Western medicine. So I think patients are now starting to seek this more collaborative relationship with their physician, someone who, they can identify with, establish commonalities, common interests, whether that's sex, gender, ethnicity, language is a big one, religion also. So that's one mold that needs to be broken. To whom medicine is taught, that's another mold. I think the oldest medical school in the United States was in the 1760s, I believe, out of Pennsylvania. But it took almost 100 years for the first woman to graduate from medical school in the United States. And when we talk about an African-American woman, I believe that was 1864. And then an African-American man was in the 1840s. So 100 years of one way of doing things. And even now, coming up to modern times, women have sort of closed that gap in medical education. And we're now, I believe, AAMC, American Association of American Medical Colleges, put out a statistic in 2019, 52% we make up of medical school matriculants. However, I'm a cardiologist. Only 3% of cardiologists identify as African American. So that's, the diversity in medical schools has a way to go, right? Why is only 6% African American, 5% Hispanic or Latino identifying in medical school, right? So that's another mold that needs to be broken. So when we talk about breaking molds, I think of them, there's multiples. There's also how is medical education taught? That's another mold, you know,
Yep.
traditional amphitheater didactics, lectured, being taught at, right, passive learning. It's now, I believe, Hofstra Zucker School of Medicine has taken a very, very bold step in this direction in breaking this particular mold, focusing on problem-based learning, experiential, clinical experiences, labs, group discussions, and taking the student out of that passive learning environment and turning it into a more active experience. So many different ways to view that question.
Dr. Brown, thank you so much for that, because I think it's so important for this conversation to understand that when we're talking about so many different aspects of medicine and care. And I think something that we didn't really mention is diversity when it also comes to clinical research, right? So why in breaking the mold when it comes to how we view who the participants are in this research. So why is it important to include diversity and people from diverse backgrounds, diverse experiences, ages in clinical research?
So I believe one of your videos touched on this, in that the default has been the man, the male body. So historically, the majority of our participants in large clinical trials upon which we've based a lot of our medical therapies, particularly in cardiology, were middle-aged and elderly white males, and women and minorities, and their representation in clinical research was lacking. So this begs the question, you know, when you're practicing, can I apply the findings or recommendations that have come out of these trials to my current clinical practice? And so the lack of diversity in research carries, you know, some significant ethical and research consequences, because there's that question of generalizability, right? Can I generalize these study results? Can I apply this to my patient population? So we extrapolate knowing that it is not a perfect fit. So the purpose behind initiatives to increase diversity in enrollment in research trials is so that our participants in the trials mirror, they're a representation of the diverse patient population that we're treating, both in race and ethnicity, in gender, in age, and so on and so forth, so that we can make effective medical advancements that's beneficial and applicable to the very patient population that we serve. So it's tailored therapy, and I think that is a big difference that we are now starting to recognize is imperative in terms of clinical research.
You know, I think sometimes people ask the question and they're curious, are men and women really that different when it comes to their healthcare?
Well, we're different in many ways, and I'm biased. I'm a woman. I think we're better. But yes, women are different. Women are different when it comes to neurohormonal, genetic, inflammatory factors that are at play. So, for example, history of preeclampsia, gestational diabetes, polycystic ovarian syndrome. If you have inflammatory disorder, lupus, which is more common in women than men. If you're on hormonal replacement therapy, these all play a role in your risk for cardiovascular disease. So knowing a woman's history, particularly around gestational aspects, right? So if this is a woman who has had children, knowing her pregnancy history is important, and it has implications on health outcomes. There's also differences in how men and women deposit plaque. I'm a cardiologist, so I'll talk about plaque, right? To deposit plaque and cholesterol in the arteries of the body. And that deposition and distribution is different in terms of clinical presentations. And this also speaks to the video that was shown in terms of misdiagnosis. So women present differently. We've done a few educational series about heart attack symptoms being different in men versus women. So the most common heart attack symptoms, yes, is chest pain, but women may present with stomach upset, some acid reflux type symptoms, lightheadedness, dizziness, passing out. So we have to be aware that there are differences and what those differences are, so that we can accurately and quickly, efficiently treat our women for various disease states. And as a cardiologist, particularly coronary syndromes, heart failure, etc. So studies show that women may receive less aggressive treatment and intervention because we are not cognizant, and our flags are not up, and our intuition is not, pricking us and telling us, my woman patient in front of me may not be presenting as a man would. So please consider all options, Dr. Brown, right? So I need to listen to that intuition and telling me women are different. Studies are showing this. Sex-based and genetic-based and neurohormonal-based studies are showing this. So I need to pay attention and listen carefully when my woman patient who's in front of me is telling me something that may not check all the boxes, but does require my due diligence.
I think it's fascinating when we talk about the role that sex plays, but even the role that some of the other demographic things like our ethnicity or our race play. We've talked about representation and how important it is to sometimes just see a doctor or a healthcare professional that looks like you, because that could actually potentially help you improve your health outcomes. What can large institutions like the AHA and Northwell Health do to help increase the number of healthcare professionals of color and specifically African American doctors?
So the AHA has a STEM program. STEM program is, I love the outreach to the youth. I think doing programs that are when you're in your adult years, college, when you're in med school, in my opinion, that's almost too late. I think exposure in formative years is imperative. So I'm thinking adolescence, right? And 8, 9, 10, 11, 12, the years where, you're sort of emerging from under your parents' wing and you're exploring your interests. So this starts way before medical school, in my opinion, also way before college. Some of my story, I enrolled in a junior fellows program through the New York Academy of Medicine when I was an adolescent. I was also a part of the Science Olympiad. Being exposed to those experiences not only gave me an introductory lesson in how to be a young scientist, but it also connected me with mentors, folks who were way beyond me in terms of years and decades of experience, who could say, if you're really, truly, deeply interested in this, your next step is to go here, is to apply to this, is to do this next, take this next step. And I think that is vitally important because it serves as a pipeline, so to speak, right? It serves as a bridge or pathway into this thing we call medicine and science and scientific research. So I think when you're young and your horizons are broad, right, nothing is to be excluded. If you're interested in the arts, engineering, mathematics, theater, definitely explore it all. But I think starting young, having mentorship in your young formative years, and having an organized system where after that experience, there is something to pursue subsequently, right? So it's not one and done. You sort of started that. And so say after New York Academy of Medicine, I said, this is something I want to do. I'll go into Science Olympiad. After Science Olympiad, I'm going to go into, junior sciences and do a summer internship program with a physician or a bench researcher, right? So you see it builds on itself.
Now, Dr. Brown, when we were kind of chatting in preparation for this call, you mentioned some of the work that you had done with Go Red for Women and STEM Goes Red in particular, and we talked about the role that mentorship played there, but we also talked about the statistics that tell us that there exists a gap in the number of women pursuing STEM careers. So why do you think these careers, so we're talking about science, technology, engineering, mathematics, medicine, are not attracting more women, and how can we address that?
So it's interesting because the statistic I quoted earlier about matriculation into medical school, the 50-50 split. So we're attracting, are we retaining? So let's take a step back in attraction, right? what can we do to attract and pull attention into STEM, and then retention. So I think there is still the stigma that, you know, I am nerdy and unattractive and I'm going to be stuck in a lab and sequestered in a library. It's time consuming. I won't have a life. I won't have a healthy work-life balance. And that there are a lot of things to unpack in those assumptions, right? And then there's retention. So the AAMC published an article in 2019. Nearly 40% of female physicians transition to part-time or leave medicine within 6 years of completing their residency. That's very concerning to me. And then when you do a deep dive into why that is, it does have a basis in all of these assumptions and things that we think about the role of a woman. So they, in the survey, you know, there was quoted, there's work-family conflict, salary inequity, gender bias or harassment. I don't have enough social or institutional support. When I had to go on maternity leave or needed childcare, it was a struggle. I wasn't supported. And so there are very specific interventions we can make in order to address these issues to attract, right, and retain women in medicine. So things like social and institutional support, we can address that with care provisions, maternity leave, coverage schemes that support our women who have caregiving responsibilities for elderly parents and child care for those of us who have children. In terms of work-life balance, there is a study in the Annals of Maternal Medicine. Sorry to all the husbands out there, but I'm going to burst your bubble. We do have an inequity of labor in the home. So this is also one of those things that affects retention of women in science and research, right? So when we go home as women physicians, we do about 8 to 9 more hours of work in the home life per week compared to our male counterparts. Now, when you take the male counterparts, they're at work about 7 hours more, right? So they spend more time at the hospital, the office, the research lab, and about 2 or so hours less with child rearing and contributing to chores per week. So there is a conversation that needs to be had inside of the home with your spouse or life partner in terms of support for one another. And that, I think, would go quite far in terms of attracting and retaining women in the field of medicine and research.
Dr. Brown, what I love about chatting with you is that we really could talk for a whole hour, and there's so many opportunities that we have to dive deeper into these topics. Unfortunately, I do need to ask you our last question for this session, and you know, and that's really this. So let's look toward the future, right? Let's say we are successful in our work to improve diversity, increase representation. What will all of this do for health and science?
So in my opinion, there is no drawback. It is all positive. There is only upwards and onwards. I think breaking the molds, increasing diversity in research, increasing recruitment in terms of diversifying our clinical research trials, diversifying our provider population, that will only serve to mirror the patient population we treat. And our patient population is seeking urgently to see a mirror, right? They want to see themselves reflected in us. And I think by making these initiatives, making these inroads, we can achieve that goal. So it will only be positive, have a positive impact on the field of medicine. And ultimately, the goal is to have a positive impact on the lives of our patients. And this initiative, right, diversification of research, diversification of our physician pool, of our physician scientists, will only serve to better the lives of our patients.
Dr. Brown, thank you again. I also want to thank you for the work that you've done for Go Red for Women, for STEM Goes Red, and encourage anyone who's listening that if you agree with Dr. Brown and believe that part of breaking the mold is creating a new mold and setting an example through mentorship. Please reach out to the American Heart Association about STEM Goes Red and how you can get involved with our mentorship program. So Dr. Brown, as always, thank you very much. Hopefully you'll stick around to hear our next speaker. But for now, we'll ask you to turn off your camera, and until next time. Well, so now we're going to talk about breaking down barriers, and we each have unique paths through and health journeys. Now we're going to hear from Giselle Lorraine Jaramillo Toscano, who's going to tell us about her experience as a mom, a patient, and a Latina. Giselle, will you turn on your camera? Let's make sure you can unmute as well.
Yes, sorry. Hi.
Okay, I also kept myself on mute when I first joined, so it happens.
It does.
Giselle, well, welcome. Thank you, first of all, for joining us. I think what people probably want to know is just, they want to know who you are. So why don't you tell us a little bit about your story?
Okay. Thank you for having me. So my name is Giselle, and I started my heart disease journey in 2012 when I had my son. I was 20, and I didn't know it then, but I would later be diagnosed with CHF. That pregnancy was very high risk, and I suffered a lot physically, emotionally. Luckily, my son was born healthy. He was okay. And then from there, for the next couple of years, I did feel like something was wrong. I felt fatigued. I felt chest pressure. I felt something was off, but I didn't get myself checked. I didn't think anything of it. I thought, I'm young, so there's nothing wrong. And I continued. I got sick with intestinal disease, and I had to go through a couple of major surgeries to remove my colon. And while I was in the hospital, that's when they discovered that I had CHF. They actually, tested me. They did an echo, and my ejection fraction was really low. It was about 25%. And so when you're that low, you're at risk for cardiac arrest. I started treatment, medication, and I took care of myself the way that they told me to. My heart got worse, and I needed a pacemaker defibrillator implant. And when I got that, it did give me, I guess, a sense of security. I felt that it would protect me if something were to happen to me, if my heart were to stop, or but it was very difficult. And I ended up having 8 abdominal surgeries, and all of that stress, that strain on my body, I think that was what made my heart worse. I went through septic shock. It was a near-death experience, and I know for a fact that it put a lot of pressure on my heart. All of this affected me because not only was I unable to care for my son, I was constantly in the hospital, but I did want to have more children. And once I was told that I have heart disease, I was also told that I couldn't have any more children. I couldn't withstand another pregnancy, and my body, I would not make it. So that was very, very difficult for me to hear. It brought on a lot of depression. What I wanted the most was to add to my family. I wanted more children. I wanted to give my son a sibling. But then again, I understood that I couldn't do that. And I gave up on that. I went off to get married And it kind of opened up that door for me again, because that was something that I did not want to take away from my husband. I wanted to give him the blessing of having a child. And we decided to seek for a medical team that would help us, that would give me proper testing and answers. And we made a promise to each other that we would do it the right way, through the proper channels, getting the right tests. And if the answer was no, it was no. One of my biggest fears, again, was to be told no. And we found Dr. Graver at Northwell Health. And Dr. Graver was amazing and very, very straightforward. She said, I'm going to try everything that I can to give you what you want, to make your wish come true. But I'm not going to sugarcoat anything. And if the test won't allow it, then we won't go through with this. And, that's something that we were ready for. We had discussed it. We had planned for it. We went through almost a year of testing. And Dr. Graver and the maternal fetal medicine team, they gave me the green light. And so something that Dr. Graver said to me was, you have a 33% chance of getting worse, 33% chance of staying the same, or a 33% chance of getting better. And so we conceived. And during my pregnancy, it was terrifying. It was a feeling that I didn't think that I would have. I remember not being able to sleep because I would just stare at my son and cry all night, because I thought, I do not regret this. I'm going to try everything I can to have a healthy baby. But if something goes wrong, I leave my son without a mother. And I didn't really get to enjoy my pregnancy, on top of the fact that I'm very symptomatic with my heart, with my intestinal disease. It was very, very rough on me physically, but mentally as well. I was scared, I was terrified, and many times I had questioned whether I did the right thing for my son. I knew that I did the right thing for me because it's what I wanted, but I was thinking about my son, and if anything were to go wrong, it would affect him greatly. By the grace of God, everything went smoothly. There were a couple of complications, but I had my medical team was on top of me. They were always with me. I was in the clinic almost every week, and just the amount of support that I got from my medical team as well. My cardiologist she is spectacular, and they gave me a nutritionist. They gave me a therapist. Everything and anyone that I needed, they were there and they were available for me. And it was also very, very scary because all of this happened in the beginning of the pandemic. I was pregnant right when the pandemic started, and so that brought on more anxiety and more fear. Not only was I worried about something happening to my heart, I was worried about COVID, and it had, if I got COVID, being pregnant and, just medically compromised, I was scared. I was very, very scared. But I gave birth to my beautiful baby girl last year in May 15th. She's almost 1. And miraculously, she increased my heart function. And my ejection fraction went up after she was born, which we were all surprised, but it just, she's a true miracle. I can't stress enough how important it was for me to speak to my doctors and communicate with them on a regular basis, constantly. And I know that, they probably found me annoying because I was calling almost every day to ask, is this normal? Should I be feeling this? Things like that. And that's just the right way to go, because as I mentioned, there were some complications toward the end of the pregnancy. And had I not voiced my concerns to my doctor, something could have really happened to my daughter. And she was actually induced. I was induced at 37 weeks, and we had to deliver early because something was wrong, and I realized that. And they did further testing, and yeah, they found out that something was wrong. So
Well,
that's
Giselle, look, thank you so much for sharing your story, and congratulations on making it to the other side, and your two beautiful children, and with a birthday coming up this Saturday.
yes.
What do you hope other women listening who will hear this in the future will learn from your experience?
Something that I tell everyone is that heart disease does not discriminate at all. I was 23 when I was diagnosed with CHF. And what I first thought was, this is impossible, I'm too young. But it definitely, it does not discriminate. And another thing is, I do hope that there can be more testing for pregnant women. Pregnancy is something normal. A woman gets pregnant and then you go through your normal OBGYN appointments. But I do wish there was testing. There's heart testing for these for women that are pregnant, because somewhere along the way, during pregnancy or even after delivery, it's such a stress on your body. The blood volume increase, at just everything, your organs just shift, everything changes for you to accommodate a growing baby. You're growing a life in your body. And so I think there should be further testing. I think that women should seek an echocardiogram just to check if everything is okay. Because after my son was born, they did, and after I got diagnosed with CHF, they did tell me that it was because of my pregnancy with him. And had I known, or had I listened to my body during those first 3 years where I didn't know what was going on, I think I would have suffered a little less. Another thing is, we do so much for everyone else. As a woman, naturally, we're born to just give, to care for, and especially when you have children, or when your family, you do so much for your family, you do so much for everyone else, that you kind of sort of forget about yourself. I can't stress how many times my husband has had to remind me to drink water throughout the day, because I forget. I'm busy with my children, or I'm busy doing something else and I forget. And it's just little things like that we have to pay attention to. We have to listen to our bodies.
I think that's such an important message. And I think something that I'm so impressed by you is you always speak up and you always communicate your needs. You always are your own advocate. So why is it important for women and patients to be their own advocates?
For me, I think it's because it's what I just said. We're busy taking care of everyone else. We have to remember to take care of ourselves. Mm-hmm. Something I didn't understand, and I don't know if this makes sense, but something I didn't understand before when I would travel and be in an airplane was, why should I put on my mask first? They tell you to put on your mask before putting it on your child. And I'm like, I would put it on my child first. But if something happens to you and you don't have your mask, how are you going to take care of your child? How are you going to be there for them? And so it's important to take care of yourself and just focus a little on yourself. Remember that you need care too. Mm-hmm. In order for you to actually be there for your family and get where you need to go. It's important for you to speak up and talk to your doctors, because if you hide your symptoms, or if you're not sure about your symptoms, they can clarify, they can test you, and then you can catch something very early on. So it's very important to anything that you feel off about, to speak up about.
Something that you said, and I love that analogy, but something that you said when we were chatting is that it's okay to be strong and stubborn and resilient, but that's not always enough. You talked about doing things the right way.
Yeah. I I wanted to have a child so bad that it crossed my mind, I'm just going to get pregnant and I'm just going to see where that goes and see where that takes me. And then I'll seek care. But that was definitely not the right way. And I'm really glad that I sought medical help first, because they gave me everything that I needed. Whether it's as simple as a telephone number, if I need to call someone for help, that telephone number helped me throughout my pregnancy so much. Because like I said, I called them almost every day, and it's reassuring and it's helpful, and it can save your life. You need to do things the right way, and actually speak to a doctor, because they know what they're talking about. They have and they have testing. And that's just something that is very important for me. And it was very important for me during my pregnancy. They did save my life, and they saved my daughter's life. They made it possible for her to be here.
Giselle, when we also talk about breaking down barriers, it's important to identify barriers. We know that sometimes language is a barrier. You shared with me your family is Latino, right? You're a Latina. You also mentioned your grandmother and some of the barriers that she faced in seeking care. Can you tell us about language as a barrier?
Yes, absolutely. My grandmother, she suffered from diabetes and heart disease, and she passed in her early 60s. I was about 3 years old, so I don't have much memory of her. But what hurts me the most is that she could have asked for more help. And I know that she had great care, because from what my mother tells me, she went to a good hospital and she received care over there. But I know that sometimes when you speak another language, it's hard for you to communicate. You feel a little shy, maybe even embarrassed, even to ask for help or ask more questions. I think that now, over the past couple of years, there's translating available for people. And I don't know if that was available when my grandmother was still alive, but had it been, I think that would have helped her, and she would have probably had a couple more years with us. With my mother, even, or with my parents, many times they ask me to read something for them because they need help. They get a test result from the doctor and they need me to translate, but I can only do so much because I don't know all of the medical terminology that a doctor knows. And so I think it's important for that kind of help to be available to patients. Even a phone call, translation through a phone call, that can be of great help to someone who doesn't really know the language and has trouble communicating.
Well, thank you, Jill. I think a lot of people will be able to identify with that and hopefully learn from your family's experience. Something that you mentioned too was how important it was to have a doctor and a team that you trust and that are going to play that role in your care and comfort. So what role does trust play in your care?
I met Dr. Graver, and the way that she greeted me, the way that she spoke to me, the way that she listened to my concerns and just paid attention to everything that I wanted as a patient, that was extremely important for me. So much so that Dr. Graver now she means the world to me for so many reasons. And it's not just because she helped me throughout my pregnancy. It's the manner that she had with me. She helped me, and my entire medical team helped me throughout my pregnancy. And I'm not going to only say my pregnancy, because throughout my surgeries, I've had excellent surgeons, excellent doctors who have been on top of my care. And it's very important for me to have a good relationship with these doctors so that I can voice my concerns if an issue pops up. And in my case, they kind of always do. I'm that 1% that, just issues always arise. I've had a lot of complications, and luckily I've had great doctors to be there for me. They're also a great support system, and it's very important to have open communication and just a way to access them, because I know it's kind of hard to get in touch with your doctor sometimes. So an email, maybe an email address or a phone number to someone who can get you directly in touch to a doctor is very important. Very important.
Well, thank you so much, Giselle, for sharing your story. I want to give you an opportunity to mention one more thing. So our next segment is going to talk about the connection between mental health and physical health. You also mentioned that you struggled with some mental health, some depression during your pregnancy, before your pregnancy. What can you say to women and men struggling with mental health?
It's actually very common. And you may feel like you're alone, and you may feel like no one else out there is possibly going through what you're going through, and they cannot understand. But chances are there is someone out there. There's so many people out in the world. And if you would look at me, walk by you in the street, you can never tell that something is wrong. And so who's to say that you don't walk by someone every day and something is wrong? It's okay to break down. It's okay to cry. It's okay to have cloudy days. It's okay to have bad days, as so long as you pick yourself up and remember that you are worth the fight. And if you just get up and push yourself a little bit, you can keep on going. It gets difficult, but I think it's very important to reach out and talk to someone. Chances are someone will understand. And if they're not going through the same thing, then they can offer a helping hand. I can't stress how many times I've had to reach out because I felt like my world was crumbling. Nobody at my age was going through what I was going through. And it was very hard to have anything in common with my friends or anyone for that matter. So I did seek support groups. I did seek therapy because I needed help. I needed to let it out, and I needed to speak out on what I was going through. And I came to find that there were people, and there are people my age who are experiencing medical conditions just like me. And that really, really helped. And I went through a lot of depression when I learned that I couldn't have another baby. But I kept going. And I fought hard for my family, and she's here.
Well, Giselle, thank you so much. I want you to know, and really your children to know, that they have a resilient and strong mom who is going to keep fighting. So thank you so much. We'll say happy birthday to the baby who turns 1 later this week.
Thank you. Thank you so much.
All right, and I can't wait to speak again. I hope you continue to share your story and volunteer for the American Heart Association.
Definitely.
Sounds good. All righty. And now I'd like to welcome Dr. Christina Delegates. Hi, Doctor.
Hi, how are you?
Doing well. Thank you so much for really joining us today, for listening to the first part of our conversation. Doctor, I think it's so important for us to make this connection, the link between mental health and physical health, especially right now during COVID-19, as we're hopefully seeing some light at the end of the tunnel. But can you tell us, how does your mental health affect your physical health, and vice versa? Does your physical health affect your mental health? And should we think of them as together?
Yes, absolutely. So we should think of them as intertwined. There's a bi-directional relationship between the two. For instance, when we experience stress, our brains send out signals to our entire body to get us ready for action. Our body produces adrenaline and stress hormones. It increases our heart rate, our blood pressure, our blood sugar. And this is really so that we can keep ourselves safe during a threatening situation. But after the stressors pass, then the brain sends another signal, a relaxation signal, which reverses those changes and relaxes our mind and our body. During this chronic stressor of the pandemic, our body hasn't been able to relax, and the prolonged stress hormone levels increase our body's inflammation. And that makes us, unfortunately, more susceptible to getting sick. It can worsen blood sugar and blood pressure control, and it contributes to sleep problems, fatigue, and depression. On the other hand, healthy habits, such as good sleep hygiene, exercise, a healthy diet, those support the brain to reduce the impact of stress and to reduce inflammation. And that improves our mental health and our physical health. So they're so intricately connected. It's quite amazing.
You know, I think for many years, mental health had a certain stigma behind it. People didn't want to talk about it. It was ignored. What's happened to change that? Do you think COVID-19 has played a role? Has social isolation impacted us? Why are we more willing to talk about it now?
Yeah, the chronic stress of the pandemic has certainly shown a light on the importance of mental health, as so many women and men, especially women, have had increased rates of depression and anxiety during this time. According to the American Psychological Association, 25% of essential workers and 25% of parents have been diagnosed with a mental health disorder during this time. Seeking support from those you love and trust is an important strategy to reduce stress. I think Giselle mentioned this too, that talking to others and reaching out and getting support from others. So, the social isolation of the pandemic has in effect weakened one of our best defenses against stress, being close to others. So yes, on both accounts, yes, it's shown a light to the importance of emotional, behavioral, and mental health. And also, unfortunately, the isolation that many of us have experienced from the pandemic has kind of taken one of our resilience factors away from us. So we have to kind of fight back and be with others the best we can during this time.
You started to kind of talk about it, but why should women in particular be mindful of their mental health?
Yeah, so unfortunately, women are twice as likely to develop clinical depression and anxiety than men are. And this increased risk and prevalence, as we call it, is present right from puberty all the way up through menopause. So the reproductive years of a woman's life. Because women are more susceptible, more likely to develop depression and anxiety in their lifetimes, especially around periods where they have hormonal change, so linked to their menstrual cycle or pregnancy or towards menopause, we really, as women, need to attend to our emotional health even more so than men.
And one trend that we've read about during COVID-19, and it seems like it's impacting men and women, has been an increase in alcohol use and recreational drug abuse. How can alcohol and drugs impact our mental health in this moment?
Yeah, so the pandemic stress has really led, as you noted, to misuse of alcohol and drugs. They clearly impact our mental health. They work directly on the brain. Alcohol or drug use impairs our sleep, our memory, our decision-making ability, and that can result in impulsive and risky behaviors. And, if it leads to longer term use or chronic use of these substances, it actually causes brain shrinkage and brain damage, in addition to all the other physical effects it has on every major body system. So this use is also increased with increased rates of depression, anxiety, and suicide. And when they do the studies, and I'm so glad they're doing this now because we have to break the mold. We have to do the work to look at the effects that are different in men and women, both on the brain and the rest of their body. But the science has shown us that women are more susceptible to these poor medical outcomes from substance use than men are. And so the effects of these, recreational drug use and increased alcohol use appear differently in men and women. And so, we're seeing, sex differences in these effects. And unfortunately, during this time, we have had increased use of these substances.
So we've seen the unhealthy ways to cope with the stress and the additional pressures from the pandemic. But now let's break through, right? What are the healthy ways for people to improve their mental health and practice mindfulness at home? I'm really asking about the lifestyle changes we can implement.
Yeah, this is creating a toolkit. So this is, creating a resilience toolkit. And physical activity is one of those ways that you can improve your mental health and your physical health and increase resilience to stress, pandemic or any other type of stress. And so the way the physical activity works is that one of the ways is that it's impacting and combating inflammation from stress. And simple things can be effective. So a brisk 30-minute walk, or even a dance session in the living room a few times a week will do the trick. Research shows that mindful meditation also reduces psychological stress and anxiety. Even brief meditation gives benefit. So one can get started with just setting aside 5 minutes in a quiet place to sit and to focus on your breathing, can focus on the present moment. And if, those stray thoughts intrude, just acknowledge them and just let them go. Don't judge yourself for any mind wandering, because it's bound to happen. And it's really a training exercise. You train your mind to be simply focused on your breathing or inwards. After you gently refocus, you just keep bringing your attention back to the present moment. Protecting your sleep is also critically important. Daytime stress affects our nighttime sleep. And so having, consistent sleep routines of getting up at the same time, going to bed at the same time, whether or not what your day looks like, getting up and going to bed at the same time, allow time for winding down before lights are out. The meditation I spoke about and relaxation can also help with insomnia. Avoiding caffeine and alcohol use in the late afternoon, in the evening, also is important because that disrupts our sleep rhythms. And then our screens, the blue light actually suppresses the sleepy hormone we call melatonin, and that disrupts our ability to fall asleep. And then all that good physical activity during the day also helps us get a real efficient and restful night's sleep as well. Sleep is connected to so many body systems. So it's important for so many aspects of health. And, again, creating these kits of reaching out to others whom you trust to talk to, taking time for yourself, being mindful, having times for relaxation. There was an article the other day that just talked about the benefits of nature. Sometimes just opening a window and looking at a tree that's outside for a few minutes every day, or taking a walk in nature, or watching the birds in your backyard. All of those things have shown to reduce your stress hormone levels. So there's so many things. They're simple things. They're not expensive things, but it's just creating habits, healthy habits.
I love it. I love it. Simple, not expensive, but done over, in the long term, they can have, it sounds like, considerable positive impact on your health.
Absolutely.
Now, Dr. Delegates, when you were asked to join this conversation, was there like a point that you really wanted to get out, a message for the viewers that you really wanted them to take home?
Yeah, so I'm an optimist. So there's a light at the end of this tunnel. We will emerge stronger than we were prior to this pandemic. We want to empower women to take care of their health, their family's health, and their community. Giselle had said this too, of women don't empower themselves, to take care of themselves. We're always caring for everyone else, but we need to be strong for the sake of being strong, because we deserve to be strong. In addition, we can be stronger for others. We need to take back control of our health. This will increase our resilience to the current stressors and also future stressors. We can break through this pandemic by creating a healthy toolkit of these resilience strategies and by staying up to date with our health screenings. This is another really important thing I want to communicate, whether that's going for a blood pressure check, a pap smear, a mammogram, whatever body system has its health check that you should go to, this is the time to reconnect with your doctor. Your doctor should also ask you about your emotional health. And if not, don't hesitate to talk to him or her about it. It's so important. We have to maintain our health, and we really can break through the pandemic by utilizing these tools.
Well, Dr. Delegates, unfortunately, we are just about at the top of the hour. Thank you so much. I think we're going to leave it there with that final message of empowerment and leveraging this moment. Just as a recap to what you just said, how important it is to get back in touch with your doctor and to include a conversation about your mental health. So thank you for those last 2 points that were made. I want to once again thank all of today's special guests. Dr. Brown, it's always a pleasure to chat with you. Giselle, I mean, just the courage that you show by sharing your story just really means the world to us. And of course, Dr. Delegates sharing us a little bit about ways to create that toolkit. And then I want to thank you, the viewers, for taking part in this conversation. And finally, I want to thank Northwell Health for being our presenting sponsor for Take a Break, a conversation on women's health. On behalf of everyone at the American Heart Association, thank you so much. Be well and continue to take care of your heart and your brain. Until the next time, take care, folks.